Good day. With this presentation, I'm going to give you feedback on formative test 2. I hope that you have completed the test prior to accessing this feedback so that you can get the most out of the formative test, but also so that you can mark especially the scenario questions as we go along. So formative test 2 includes 2 sections. The first one has 5 scenario questions. Each of those scenario questions are worth 3 marks, and image manipulation software is available for this section. And then section B also includes 5 questions, but these are MCQ questions, and each of those equals 1 mark. So I'm going to discuss the scenario questions using the software. So the first case is that of a patient who was knocked down by a car and has a swollen right thigh. So it's quite evident on this AP image that there is a spiral fracture. We can also see that there is severe distraction of this fracture. And then also that when we look at the AP, the distal part has been displaced medially. When we look at the lateral view, we can now see that it's not just displaced medially, it's also displaced dorsally. So a comment should read here that there is a midshaft spiral fracture of the femur with severe distraction and distal bone dorsomedially displacement, and there's also extensive soft tissue swelling. And then for our next case, this is a patient with a painful right hip, and there's no history of any injury, and it's asked to exclude pathology. So I'm just going to zoom in, especially around the hip area. So if we compare the right hip to the left hip, we can see that the hip on the right side, the femoral head, is sclerotic, but it's also flattened in comparison to the left side. So it's smaller. So the femoral head has the appearance of Leckalvi-Perthes disease, and this is chronic. This is long-standing disease here. So the next case is that of a patient who fell and has tenderness over the left hip area. And what we could maybe do here is to just make it a little bit lighter, if that would help. And then we can also zoom in a bit. So comparing right hip to left hip, we can see there's foreshortening of the femoral neck, which indicates that there is a neck of femur fracture. And then also, if we look then at the horizontal view, the lateral view, there's no dislocation of the hip joint, so that is still intact. And then going back to the AP view, we can also see that there's a calcified femoral artery. So the overall comment for this one then is that there is a neck of femur fracture. It's just mildly displaced. However, there's no evidence of any dislocation of the left hip, and there's an incidental finding of a calcified femoral artery. So for case 4, this is a patient complaining of chronic back pain, especially over the thoracic area. So for this one, it would really be useful just to play around with the windowing because it's quite dark. And then remember, when you look at the thoracic spine, is to find the last rib, which would indicate that that is T12 that you're looking at. And then we can see that there is complete collapse of this vertebra. So looking at this is 12, 11, 10, 9, 8. So there's complete collapse of the T8 vertebra. And we can also see that there is some reduction in vertebral body height of the lower vertebra of the thoracic spine, but also some osteophytic clipping as well. So on the lateral view, we are able to see that is T8, and then also some compression fractures, which compression fractures of T9, T10, and possibly L1 as well. Just going back to the AP view. So normally the vertebra becomes progressively bigger. So if we look at L1 and compare to T12, we can see that there is a drop in vertebral body height. So overall comment then is there is complete collapse of T8, with which compression fractures of T9, T10, as well as L1, and there's some osteophytic lipping evident. And then the final case is a patient who was in a motor vehicle accident and has a painful upper lumbar region. So I think the best views that we have here is on the lateral. So if we look at the lateral view, we can see this horizontally sclerotic appearances of fractures. And there is another view as well, which actually shows it so much better. So what we have here are chance fractures. These are horizontal fractures, and it splits the posterior elements. And these are 3-column injuries that are unstable. So that's T12, so L1, L2, and L3. So if you look, there's loss of vertebral body heights as well. And on the previous image, so 5, 4, 3, 2, 1, and with T12, we can also see there is a compression fracture as well. If we then look on the AP view, we can see this is T12, which should get progressively bigger. There's a loss of vertebral body height there. So we have got chance fractures of L1, 2, and L3, and a compression fracture of T12. So those are then our scenario questions. So I would encourage you to make use of the software when you answer those questions. So moving on to the MCQ. So the first question is the Shenton's line and the line that it follows. So Shenton's line is followed as a gentle curve of the lower border of the superior pubic ramus and the inferior border of the femoral neck. And it's a useful line to follow to see whether there's any dislocation of the hip. And the next question is, where does the hamstring attaches? It, of course, attaches to the ischial tuberosity. And then another MCQ, adult hip dysplasia, progressive. So as it becomes more progressive, it will in the end lead to chronic hip dislocation. So this is more towards a chronic stage that you will find hip dislocation. And then the next question is about the normal thoracic paraspinal line. So of these options, the right paraspinal line is not normally seen on a normal thoracic spine image. And then the final one regarding tumors of the spine, so which is the most appropriate answer here, is that these tumors can have either a lytic or a sclerotic appearance. Okay, so that is then the feedback on formative test 2. Remember, for your final exam, it will cover all the material that we've delivered for this unit. And it means that you also need to revise again formative test 1 as well, as you prepare for this exam. So a lot of material that needs to be covered. In terms of this feedback, then for formative test 2, you can undertake it as many times as you wish. And please feel free to contact me should you have any questions. Thank you.